Welcome to Joint Effort PAs, where two orthopedic surgery PAs get real about life in medicine. From tips and tricks to professional growth, work-life balance, and everything in between. We're here to share what we've learned and what we're still figuring out. Let's get into it. So, first off, the fans were very upset for our last week off, so we'll have to be better about pre-recording in the future for
Yes.
stuff. What did you do for your Labor Day?
Yeah, so I actually I was supposed to go to the beach with my family, which there's 5 of us total, and as it came closer to, um 3 out of the 5 were not able to come. My husband grew up in upstate New York, and he is kind of a country boy, and he ordered a cow, and the cow in its parts was being delivered, and this is a very time sensitive thing.
Yeah.
So he needed to be not at the beach. Which I I literally heard this and I just was like, "Okay." And then my oldest one is working off some debt, so she worked, so I kind of promoted that. My youngest one, who's 11, got invited to these 2 epic sleepovers, and her missing them was, quote, "social suicide." So, because my husband was home, I had her stay, so it was actually me and my son went to the beach. We invited a friend and her 2 boys, so it was us and our sons, and actually it was a great time. What
Nice.
about you?
I moved, which was exciting, and I also was like up and down a bajillion flights of stairs all weekend, and then I couldn't walk by Tuesday when I came back. So it was great. I
It was
got a lot of
great
good exercise in.
great physically and otherwise, it sounds like.
Yes, yes. Okay, so today we are going to discuss how to not suck.
Yes. And we say it like that because, I mean, we could have titled this How to Be a Great PA, but I think more so we're going to focus on the traits that make a really, really crappy PA.
If you don't do the wrong things, you
Yeah.
will do the right thing.
Yes. So
Yeah.
almost a guideline
Yeah.
of how not to suck. So now, being a PA, just for those who are either in PA school, don't know anything about PAs, all of us go to PA school and have general training in specialties and also in various parts of medicine. So, like, I did rotations in internal medicine, OBGYN, pediatrics, surgery, but the academic part of that is uniform throughout all PAs. So theoretically, all PAs graduate and they're all equally awesome, but that is 100% not the truth.
Right.
Yeah.
Yeah. Yeah.
So every program is a little bit different as far as what they focus on, but the actual layout of PA school is 1 year or 3 semesters of academics, at least my program was, and then a whole year of rotations. So you're exposed to all the things in medicine and you have the potential to be great. But I think a lot of things play into what makes a great PA and not. So let's dive into the good stuff. Okay.
Be
So the
good.
good PA. Let's take various situations and see if we can explain this.
Yeah. So, one big thing that we were going to touch on with this is just having a great attitude. Having a bad attitude can be a black cloud over your entire team and
Yes.
clinic. So, having a great attitude goes a long way.
Yeah. So attitude is huge. So those that I know that are working, as a PA are in a field they love, therefore going to work is exciting, enthusiastic. But, you will work with some PAs or interact with some PAs if you're a patient that just don't like what they're doing. And if that comes out in a negative attitude, it literally drags everybody down.
Yeah. Can you imagine just like being miserable every day when you show up and
No.
hating your job? Like,
But everything, like, even if you're delivering good news to a patient of like, hey, I looked at your x-rays, this is what it is. Or if you're delivering bad news, like if you were receiving bad news from a PA that hates life and hates themselves, that's terrible.
yeah.
Yeah. So, I mean, I think your personality goes a long, long way. Um, Now, your work personality versus your outside of work personality. Do you have two, Hannah?
I don't think so. I think they're the same.
Yeah.
Yeah.
Yeah. I mean, I think it's more important when you are at work. Like, we are all working in the customer service business because patients come in and they choose us, right? So if we are not our awesome selves, they can go somewhere else and find
Right.
that somewhere else. So I think, bringing a positive attitude, encouragement will help again, your patient interactions, but also your teammates will appreciate you more.
Yeah. And, some days you're just not feeling it, but you got to put on a show.
That is true.
This is your stage.
That is true.
Right? So.
Now, when I interview PA, I will ask them, like, when you're done with your day, like you're done seeing your patients, you're done with your notes, you're ready to go, like, do you just pack up and leave, or do you try to find, like, is there anything else I can do? Make a goal for tomorrow. Like, hey, I struggled with this knee exam today. Maybe tomorrow I'll look and see if I can connect with someone on the knee team. So talk about going the extra mile.
Yeah. So super important. I think like it helps you connect with your role better too. The more you invest yourself into it, the more attached to your job and position you're going to be. So things just like outside of work hours. And I'm not saying this in the sense that like I condone spending your entire life hyper focused on only your career. If that's something you choose to do, fine. But I'm not saying that's the only way to be successful. So, like attending webinars, conferences, extra learning, reading, just prepping for things on your own time and taking that initiative to go the extra mile and learn new things and different things and not having the expectation that that's always going to be fed to you. Um, for me, I love going to conferences. I love reading journals and I attend webinars very regularly. Like I will seek them out. And, I talk to people all the time who are like, oh, how do you find these things or whatever? How do you know about it? Like nobody's going to spoon feed this to you. Like we live in the day and age of Google. You can go find it very easily. There's so many outlets for learning new information. There's like almost no excuse in my mind for not going out and trying to better yourself.
So it's funny you said that. We actually made just this past week, so I work on a team that we treat patients with shoulder and knee pain. So we made a form. And again, it's just like an after summary visit. And the form just says our approach to knee pain. And it was just kind of a theoretical piece of, our approach is to control your knee pain. We, will do various things such as bracing, injections, physical therapy. We talked about body weight. We talked about supplements. And it's just a summary piece of stuff we do every day, but it was not like in one place that I provided to a couple of patients this week. The patients were like, oh my God, like this is exactly what I was looking for.
Yeah.
Our patients, they'll ask certain things like, oh, have you heard about this minimally invasive knee surgery? And, sometimes when I'm faced with whatever that is, and again, it can be from like, I don't know, any infomercial they watch or something in the paper, like I will do my job and kind of look and see what's out there and see what they're talking about, just to have that communication, because that interaction can be like, no, moving on. Or you can, engage with them and say, oh yeah, no, I did hear about this. And this is the story behind this.
Yeah.
So just something that makes the patient feel like you are invested in what you're doing and you're kind of staying current with, anything new that's going on. I think that also instills trust in that relationship.
Yeah. And like being okay, I don't know, I'm sure we're going to get to this later on, but that kind of segues into it, like being okay with what you don't know going off of that. So like if somebody brings up a procedure that you haven't heard of or has like just a very complicated case and you don't fully understand it, being okay not knowing things and being honest with the patient about it, I think for a very long time initially in my career, which hasn't been that long to be fair, but initially that's a scary thing. Like I don't want to tell somebody that I don't know what's going on. And I'm now in the place where if I don't know what's going on, I'm going to tell them. And I think that honesty goes a long way. I think they ultimately end up actually trusting you more if you say, this is kind of abnormal. I'm not 100% sure I'm going to need to like consult with somebody about it or look into X, Y, and Z more. And I think they actually appreciate that more than obviously just being like trying to make something up. You know?
So I think the person-specific things about being a good PA, we covered your attitude. Again, that's what you bring to the table. That has nothing to do with where you went to school or how much you know. Going the extra mile, that is also something that is a personal thing that you bring to the table. That's not necessarily taught at Hannah's school versus my PA school. Now, asking for help and collaboration, like each PA will come into their specialty, if it is a specialty, or whatever line of work they're doing, and you have a baseline level of knowledge. But like I tell all of our new hires, you should know a little bit about everything, but not necessarily a lot about everything. So when you work in a specialty like orthopedics, like Hannah knows more about the ins and outs of hand and wrist than I do, but I've been doing this longer. But that's her world. And I expect her, if she's in that specialty, to be all in and know everything. But again, you'll even say every day you'll see something and you're like, I don't know what this is.
Yeah.
But another really good, I guess, teaching point or piece of advice is both myself and Hannah work with a supervising physician. And when I need to like talk it out, like I just need to say, like, here, this is what I'm thinking. Can I bounce this off of you and let me know if it's right or wrong? That is a much higher skill level than, hey, this one has knee pain. What do you want me to do with this?
Right.
You
Yeah.
know, that's not problem solving.
Yeah.
The physician you work with, I promise, will look at you and blink a couple times. Like, you need to bring to the table when you're hired for a certain level of complex thinking. If you don't arrive at that answer without collaboration, that's actually far better than just saying, hey, this one is wanting to see you today.
Mm-hmm.
Here you go.
Yeah.
And I like the fact that we can collaborate and we're encouraged to do so, because I feel like, I mean, yes, there's a lot of autonomy and independence, but for the complicated stuff, I want to have another set of ears just to say, you know, if they agree, great. Then it makes me feel more confident. If they're like, hey, but also try this. I'm like, oh my God, I didn't think about that.
Yeah.
Thank you so much. You know,
Yeah.
I had a really good piece of advice from one of the physicians I worked with in the past. Further testing, right? So if you order an X-ray and you order an MRI scan, if you really are invested in what you're doing, you listen to the HPI, you examine the patient correctly, you listen to mechanism of injury, your diagnostic tests are actually confirmatory. So
Mhm.
I'm not ordering the X-ray to, quote, see what's going on. I'm ordering the X-ray to confirm that it is or isn't a fracture at the place that they're hurting. Or I'm
Right.
ordering the MRI scan to confirm, not to see, well, let's see what it shows, you know? So I think really focusing your line of thought as far as how you go through that visit and how you use your testing too is really important.
You should mostly know what's going on
Mostly know
before
what's
looking
going on.
at the imaging.
Yes, 100%.
Okay. Well, that's all the good stuff, which is great, but I want to hear the bad things.
Yes. So again, this is near and dear to my heart because I spend a pretty large majority of my year interviewing PAs and going through their resumes. And, you know, I have an idea of the traits that I want to see. Like I want a PA to come in for an interview and be like, listen, I have a great attitude. I can multitask. I know when to ask for help. I'm not intimidated. You know, I have confidence, but when I know when I don't, like I'm like, yes, yes, oh my God, yes. But PAs never come in for interviews telling you that, like, hey, I don't like being wrong. I kind of floated through PA school working with, you know, my roommate. You know, I really need to spend a lot of time making decisions before I can move. Like these are all things that really make for a not wonderful PA. And again, we'll dive through some
Makes
personality stuff. It makes you suck. We'll dive through some personality stuff as well as just some overall traits that we see. And then again, this is your cautionary tale. You got to stay away from this stuff.
Don't be this person. All right. So being overconfident, like you mentioned, or just having an ego about you, like dangerous. Don't love that.
Yeah. So the overconfident, egotistical PA that does not have the experience or the know-how to back that. That is pitfall number one.
Even if you do have the experience to back it, like, do you have to let it show to the point where people know that you're like overconfidence is not good. Confidence is good. Confidence is great. You have to be confident. Everybody loves that, but overconfidence, that's never a good thing.
No, and I think overconfidence also means that you've got blind spots to the things that you don't know. And having a big ego, again, it gives you a blind spot to admitting when you don't really know something. So I've seen this before. And again, like, you know, if you come in and you're like, yeah, like I know ortho because I was a high school football player. I'm like, okay, like you might know a little bit more than someone who didn't play sports, but that does not necessarily mean that you can analyze, treat, and carry out treatment plans. Those are fun conversations when you have to sit down and overconfident, egotistical PA and explain to them that they don't really know everything. It's just a very hard person to have on the team because it really throws off team dynamics. Again, not to be confused with the competent, confident PA. This
Yes.
is the overconfident, more concerned about, getting the praise than the work that they're doing.
Yeah.
Definitely
There
don't like that.
is
2 thumbs down.
It is not a weakness to ask for help and things that you don't know. You want to be comfortable asking questions and not knowing things and learning more. I think,
For example, like we've done post-op care for patients, and how many times do patients say to you, "Am I ever going to get 100%?" And the overconfident PA is like, "Absolutely. If you choose us, you'll definitely get 100%."
oh
Like,
gosh,
I
set
mean,
yourself up for
set yourself up for
failure.
failure. Like
Set everyone up for
yeah, I mean,
failure.
everything I do, I want there to be a perfect result and the expected response, but unfortunately, that's just not the case.
Yeah.
Um,
Yeah. You have to be okay having these hard conversations. And the more comfortable, this isn't, I don't know if it's a confidence thing, or maybe it is a confidence thing. I think it does come with confidence and competence over time, but being okay telling a patient that, like, you're not 100% sure with what's going on, or if this is going to completely take care of all of their symptoms, and like you said before, giving them um your algorithmic thought processing with it, and not just like, yeah, lying to
yes.
sound good,
Yeah.
you know. Yuck.
So this is a little bit of a branch from the PA that's overconfident and egotistical. But what about those PAs that, again, were ortho, right? That get into ortho and just bowl through all the visits and don't even recognize that they don't know the things that they don't know.
Yeah.
Okay. So, like, for example, uh, every patient that twists their knee that has pain on the inside of your knee, that's a meniscus tear. Oh, wait, but you didn't consider an MCL tear. You didn't consider a medial tibial plateau fracture. If you don't know the list of things that can be, and you're just so focused on the most common, that definitely is a handicap.
Yeah.
Definitely. And not being open to education or feedback.
Right.
So I've hired some of those in the past, and ooh, those are tough too.
Yeah.
Not recognizing those blind spots, that's another huge red flag. So again, unfortunate for all the PAs that I've worked in the past, but wanting to do it all without knowing the knowledge too. So it is, it's considered what, courageous and bold if you do something new and you're right. If you do something new and you're way off track, it's reckless.
Yeah.
So there's a difference, right?
Yeah.
So I had a PA in the past that loved procedures.
Oh no.
Oh yes. and working in an urgent care setting where there's a ton of patients checking in, you can't buckle down and do a 2-hour procedure just because it's exciting to you.
Yeah, and you feel like doing something fun.
Yeah. So
Yeah.
I happened to hear this patient was having this procedure done, and I walked in, and this provider was in way over his head, way over his head. So again, the interaction of like, hey, I'm just here to assist. Let me see if I can help. And the provider saying like, no, I got this. And I'm like, bro, you won. 100%
Yeah,
don't have
like
it.
No.
No.
I'm picturing this exact scenario that I recall in my mind, just like it was yesterday.
Yes, but like the risks, right? So unless you go through these various learning opportunities, like what would have been a great outcome from that is the provider afterwards would have been like, yeah, I know, I thought I had it, but I didn't. Thank you so much. And then would have been open to feedback. But instead, his response was, why did you interrupt me? Yes, I know.
It was going so well until you got in here.
Yeah. So again, like those that have the backing, like what's the difference? Like how do you know when to be bold and courageous, and how do you know when you're being reckless?
Yeah, you have to recognize those things. And this goes into our next point, which is paralysis by analysis and fear of mistakes. You also, if you've been taught how to do something, honestly, I think if you are questioning yourself a little bit, that's healthy, right? If you've been taught how to do something and you can do it, don't overthink things to the point where you're telling yourself you can't do it. You have to, at a certain point, just like jump in and do it.
Yeah.
And not everything is going to go 100%, perfect the way you want it to every single time. You're going to get better with time. It's practice over time. But yeah, you definitely have to be at the point where you know what you're doing
Yeah.
and have plan A, B, and C in your mind lined
Yeah.
out.
But for another example, like I had a provider once that had 3 patients checking into urgent care. One patient literally fell off his horse earlier that day. He walked in looking at him, the shoulder was dislocated. And then you had a patient with chronic back pain and then someone else with something else. So looking at that situation, if that were me, I'd get that dislocation to x-ray immediately, then numb them up and reduce it. This patient had checked in and was there for an hour because he was the third patient checked in. The provider wanted to double check the technique they were going to use. And I came back at the time because I had heard that there was a little bit of, a wait. And I went in the room. Hey, you are, your shoulder's dislocated. I can either pop it back in and numb you up or pop it back in and don't numb you up. And he was like, I've been sitting here for an hour. Don't numb it up. Popped it back in. The provider came in the room and was like, hey, so I'm ready to talk about this. I'm like, bro, this is
It's
done.
done.
This
Yeah.
is done. Yeah. So the paralysis by analysis, again, you have to know about yourself. Like if you want the time to think and dissect and run scenarios before you act, you need to not get in a line of medicine that requires a little bit faster paced thinking.
You might want to be an internalist.
You might want to be an internal or a hospitalist
Yeah.
where the time is yours.
Yeah.
But fear of mistakes too, like not, you see a dislocated toe and you say to yourself, I know this needs to be reduced, but like, ooh, should I? Shouldn't I? I don't know. Let me go see if someone will help me with it. Like, risk benefit. The risk of not doing it is it stays dislocated. The benefit is that they'll feel better.
Yeah.
You do it.
Yeah.
Yeah.
Come on, the toe.
Yeah.
I mean, toes are important.
It's just a toe.
Right? It's okay. I think if you asked our podiatrist, he would probably say
He'd probably say it's just a toe.
Yeah.
Yep.
Yeah. And then that goes into indecisiveness too. Avoiding things and being afraid to like make a call on something.
Yes.
What I had made notes to myself with is this happens all the time with new grads and people who are new to this specialty. Don't be confident making calls for things you actually don't know. Again, know when you're overstepping your boundaries. Like one of my biggest frustrations is when I see a patient that another provider has already seen and they told them something way off different was wrong with them, and now I have to talk the patient down. I have to like make them be confident in me without like shaming the person that they saw before, and it's a really hard thing to step around. Like for example, what I'm trying to say is that if somebody goes to an urgent care somewhere and they see a provider and they tell them that they have fracture that needs surgery or a fracture that doesn't need surgery, it's going to be totally fine. And then I, who work in a more specialized field, see that and now tell them the opposite because, hey, actually, like, this is a significantly displaced and malrotated finger fracture. We can't just buddy tape it. Like, we need to fix this. Now they're all of a sudden super not confident in me. So I think just like knowing, in your role, what kind of advice you should be giving, like steer away from those kind of definitive answers if you're not 100% sure, because then it makes the next person's job harder.
Yeah, and with that being said, I had a provider that worked on my team once that, I would say, hey, this person's coming in. The point of this visit is to see if their knee is stiff. If their knee is stiff, aka they can't bend it this many degrees, we need to sign them up for surgery to mobilize their knee. So the provider saw the patient, did the visit, and I said, hey, how did that go? And they were like, oh, well, they were pretty stiff. So I'm going to have them come in next week and have the doctor make the call. And I'm like, oh my God, like you just told me you know the problem. I told you what the solution was, but you just punted that. Like that's not why you're here.
Mm-hmm.
You know?
Your doctor doesn't want to have to be that person every single time.
So, that also too, the education with that is, hey man, like, it's okay to make those calls.
Yeah.
Especially if it's something that is very much set up for that. It doesn't always need to be the doc making the call necessarily if the treatment plan has been discussed. And again, the various situations, if not this, then this.
Yeah.
So avoiding responsibility in decision, to some extent, I think that also that also is a significant handicap. One of my biggest pet peeves is when I hire new providers, when they'll see a patient that comes in and the patient says, "Hey, I'm here for a shot." And the provider's like, I don't feel comfortable with that. And then they kick them back to the clinic side. So I hate I don't feel comfortable with that. Like, get comfortable. If you don't feel comfortable doing it, get education, watch me do 100 of them, then you do 50 of them, then get comfortable. But instead, just saying, I don't feel comfortable. That's my day. Like that, I cannot stand that.
Toxic team dynamic.
So I think in orthopedics, right? So let's break it down to the team. So my team and your team are constructed kind of similarly. So you have the surgeon, you have the PA, you have the medical assistant, if not the second one, and maybe if not the third one. So the dynamics already are that the physician kind of, makes the calls as far as what we're doing, what we're not doing, right? If the physician comes in a good mood, he's ready to go, it dictates the tone for the day. If the PA comes in with the same, energy and attitude, it matches that. And honestly, everybody follows.
Yeah.
Right? Because it's very hard when you have that higher level of functioning for someone to kind of like bring everybody down. It's really hard. Now, if you have someone in the position of power, aka the surgeon, or to less so the PA, and they come in with a crappy attitude, it puts an entire black cloud over the whole day.
Yeah.
It is terrible.
Everybody will feed off of that. Everyone will, like, if you're annoyed seeing patients that day, everyone's going to be annoyed with it.
Yeah, and if you're snippy or if you're like, you room this patient and you put them on the right instead of the left, like stupid stuff like that, like that will literally bring everybody down. So you are in a place of, guidance and leadership, and your team looks to you for that. So, if you are the Debbie Downer, if you're the guy that brings in the coffee just for yourself and says, "Sorry guys, I'm 10 minutes late. The line at Starbucks was so long," and you come in with a single coffee, like you are the a-hole.
Yeah,
like, you just
never do that.
Yes.
But yeah, you have to have a good attitude. You have to, even, if your surgeon's not in a good mood, maybe
you have to pick up.
You be in a better mood.
Yeah,
right?
you have to go overtime.
I wrote here, you are the co-captain, and in retrospect, no pun intended. Co-captain.
That is true.
It's true for you. I came up with a name. I don't know. Ace? What do you think?
Yes.
Yeah. I think that will be well received.
Yeah.
We'll see.
That's a little bit of a Top Gun or volleyball reference. Not really sure, but I like them both.
Yeah. I think it works.
Perfect.
Okay, so I also did have, I asked the people, and by the people, I mean
my coworkers,
medical assistants, actually specifically, our team's athletic trainer, who is a very, very honest individual, and I knew she would give it to me straight, about the things make a bad PA or bad qualities. I basically was like, can you tell me all of the things that I do that you hate, and I promise I won't get offended or like cry myself to sleep tonight after you send me this.
Right. So here's Hannah about to read them. I mean, like a little bit, offended, but definitely not enough.
Not enough. I'm fine right now. I'm fine. I promise. Okay. So, and you can, piggyback off of these two, not messing with clinic schedules without asking. Do you do that, Beth?
When I want to do an extra clinic, so again, one of those things that the team doesn't like is the pop-up clinic. We always want to be busy, so if we find that we're not busy and we decide on a Tuesday we need to do a pop-up clinic on a Thursday, we sometimes just do it. And the medical assistants who have to acquire the rooms, acquire the space, acquire permission, make themselves available, it was their work from home day, now they have to come in. Like, when you do that without asking them, they do hate you.
Yeah, and I see why.
I get it.
I totally get it, yeah. And I think also just like having the expectation that somebody is going to like uproot their day and their previous plans because you felt like doing that. I get it. Now, to be fair, because I will have a defense for all of these things too, because why not? I love to defend myself. If I'm ever doing that and not telling somebody, I pretty much don't have the expectation that anybody is going to come help me.
Yes.
I'll just DIY it.
But again,
it still is nice to be communicated.
Yes. But again, that's another positive. If you're going to put more work on yourself, do not expect other people to bend over backwards for you. So if you do a pop-up clinic on a Saturday, which is what my physician likes to do a lot,
Yeah.
expect that you're going to have to do a little bit of heavy lifting yourself.
Yeah. We started doing that a couple times this year, some evening clinics and stuff. So,
All right, number two.
2, cleaning up rooms after a procedure. Yeah, I used to be worse about this. I feel like hopefully I've gotten a little bit better with it. But yeah, I get the frustration with that because their job is to keep the clinic moving and flowing and functioning. So when I'm done, they should be able to go in there and just like bring somebody else in. So I get that.
Yeah, I'm going to open your brain a little bit to this. So I'm going to correlate this with real life events. So if I'm hosting, let's say, for example, my in-laws over, okay, it's my job to make food and clean up whatever. When my father-in-law gets up and does not bring his plate to the sink, I loathe him.
Yeah.
Like, I think that's what your medical system
Yeah.
is telling you.
Yeah.
Like, just clean up after yourself. I don't
Just
need
try.
a deep,
Yeah.
I don't need a deep clean.
Yeah.
But maybe I need some stuff either in the garbage
Yeah.
or brought out of the room.
Yeah. And
So
not gel everywhere. That is a common offense. I use a lot of ultrasound gel because I use the. So I'm sorry. I apologize for
She
that.
will be better.
I will be better. I'm being appreciative.
Yes.
So hopefully I probably can never do this enough. Hopefully most of the time I do voice my appreciation, but yeah, things can't happen without our clinical staff.
Yeah,
so.
and I think those that are medical providers in whatever capacity, you have to understand that people love positive reinforcement. Everybody loves to hear they're doing a good job.
Yeah.
If you hear nothing, it's either like, okay, I guess you think I suck, or it wasn't good enough for you, or something like that.
Yeah.
So, like I said, you're getting a coffee, maybe you get everyone a coffee. You're going to order a crumble cookie, maybe you get everyone's opinion as far as what they want for the day.
Mhm.
I think that's huge.
Yeah. Giving feedback, good and bad. I personally struggle with giving bad feedback to people. I'm a huge people pleaser. It pains me to give negative feedback. It's something I need to work on.
Yeah, and I think negative feedback in the moment is much better received because it's relevant.
Yeah.
But, again, why I was very much looking forward to this episode is I want everyone to be awesome all the time.
Yeah.
Like, I don't want to congratulate you necessarily because you are meeting my expectations of being awesome. And when you are less than awesome, I don't want to spend the time that I'm interacting with you telling you why you suck.
Yeah.
So I think the halfway point is maybe a conversation of like, hey, when we get busy, instead of doing this, maybe we can do this, because I think it'll flow a lot better. Like, that's very much more positive than, hey, let me tell you why you suck today.
Have some constructive criticism to back it up with.
Yes.
And my favorite, which feels not at all personal, running late because you're filming content. And this is only because it's fresh on the brain, because maybe this past Friday that was happening a lot. But yeah, I will go back to that and say everybody's got to have their thing. That's something that gives me joy and happiness in my clinic days. And so I'm going to keep making the silly Instagram videos and doing that.
So my team, when I polled them about, what do they not like about PAs or myself in general, I don't know if there was overlap or not, but when they have a ton of tasks and I am done, let's say, seeing patients, the stupid monotonous stuff like calling patients back, filling out their paperwork, like if I see that they're going to spend an hour more in clinic, they just want a little help. Like, hey, do you think you could answer this question so that I can do this 16-page out of work paperwork thing? So, offering to help, going outside of your lane a little bit and understanding the common goal at the end of the day is everybody gets out of work, right? Mm-hmm. So if I have time and I'm available, I think saying to them like, hey, do you need help with anything goes a long way. It's showing recognition. But they will tell me, maybe again, not directly, but they will tell me like, I was kind of pissed off you left at 2 and I had to sit here till 5 doing paperwork. So again, that never happens.
Never. Offer to call the difficult patient back. Take on the hard task. Take that off of everybody else.
Yes, exactly.
I also had one one comment about the hospital knock and understanding it and adhering to it.
Yeah. So let's talk about the hospital knock
Yeah.
just for a second. My hospital knock is, I will say it before I go in a room with a difficult patient or someone that just really wants a lot of time. And I'm going in for an injection. This is like a 5-second visit, right? I will spend the time talking about the patient's husband that got diagnosed with cancer and the patient, how, she ordered a new rug the other day and wants to talk about it. Like, I will do that, but respectfully so, trying to still stay on time. So I will ask for my medical assistant and I will say, hey, if I'm not out of this room in 7 minutes, I need you to knock on the door and then come in and say, hey, Med is on the phone for you.
Mm-hmm.
And then I'll say, okay. Now, it has happened, and they do that. And then sometimes I'll say, okay, I'll be right out. And then I don't.
Mm-hmm.
So I think that makes the medical assistant look dumb. And then they hate you for that a little bit. So adhering to the rules of that, when they Med's on the phone, they're never on the phone. I just know that I've hit my time.
Yeah. Well, yeah, these, so take all these to heart. Don't be this person who sucks and doesn't clean up after themselves and
doesn't help.
Films Instagram content instead of seeing patients. Like, who would do something like that?
Sucks.
Like, what kind of?
But I think to summarize, I think being a good PA, you will go to school, you will get the degree, but not all PAs are created equal. Make yourself stand out, stay curious, learn every day. If you go home every day and you did not learn something, that should not be a good day. Like, I learned something every single day. Don't be afraid to recognize the things you don't know. And that honesty with patients will help your interactions, will help your relationships. And then, it is okay to be wrong. Like, you're not going to get everything right. And that's a learning moment. So I think humbles you as a human being.
Yeah.
All right. Now, Hannah,
Mm-hmm.
things to avoid.
Things to avoid. So, in order to not suck, do not be overconfident. Be appropriately confident. Understand what you don't know. Do not leave your room a mess and put in ultrasound gel everywhere. Be done filming your Instagram content before 7:55 a.m. and appreciate your staff and show it. And have a good attitude.
Yeah, and again, I think life lesson, PA lesson, don't be an a-hole.
Yeah.
Yeah, like
it's that easy.
It is that easy. It is that easy.
All right. Well, we could use some advice from the fan base about next topics to talk about. We have a plethora, a whole list of things. And my third microphone came in, so we can finally have some of our much-awaited special guests on. So yeah, hopefully in the next couple of weeks, we'll bring on CRNA in our practice to talk about that whole dynamic, what it's like working with them and just their career path.
Yeah, and I think difficult patient interactions, I'd love to dive into that.
That's a good one.
That one is a good one. Because
everyone needs that.
The positive experiences just exist. The negative ones haunt you.
Yeah, and reviews. Like patient reviews and how that has kind of shaped medicine a little bit. That didn't used to be a thing. It's a huge thing now. Got to be a 5-star provider.
That's it. And not suck.
Thanks for tuning in to Joint Effort PAs. If you enjoyed this episode, be sure to subscribe, leave a review, and share it with a fellow PA or med-minded friend. You can also follow us on Instagram at Joint Effort PAs for updates and extra content. See you next time.